Now I'm going to share some strategies with you for wrapping a newborn's hand. Newborns' hands can be particularly challenging because of their size and because of the natural reflex of the hand to want to close and stay clenched. So one of the strategies is using just a soft cotton roll and placing that just in the palm of the hand. And what that can do, firstly, is to try and minimize any more trauma to the hand when there aren't any dressings in place. The second thing that this can help with is actually helping to keep the hand a little bit more open for when you are trying to wrap your dressing around each of the fingers. Now, if you do have someone with you who can help with the dressing, and often with newborns, you will be encouraged to have two people present. When the fingers start relaxing and you notice that the fingers are starting to relax, if you can get someone just to hold the finger while you're trying to wrap around the finger, that can be really helpful. And even if the other fingers start to close, that one finger that you're trying to get around can just be held in that slightly extended or open position. The other strategy, and what I'll demonstrate now, is with your wrap, and again, just starting and going around the wrist, making sure that it's secure, wrapping with your roll on top, is actually just stopping and waiting at the back of the hand. So the fingers will close, they might clench, and you will be waiting here for just a short time, or it might be a long time until those fingers open again. So once those fingers start opening again, you may have someone holding here at the tip. You're going to just do your normal wrap to get around the finger, okay? And once you can get around the finger, what you might find is that you actually need to just cut your dressing. And let's just do this now together. You might cut your dressing here and secure that in place with some tape. And I'll remind you that it's much easier to do all of this if you're pre-prepared. So make sure that you've cut your tape and you have all of your available equipment and dressings and products ready to go. Okay, so you may just stop there. And you might get yourself prepared again with your soft wrap and to be ready to go again with your next finger. So again, around the wrist, and again, just waiting at the back of the hand in order to do the next finger. Okay, so they might close their hand. It's waiting until they start to relax again and lift that finger up. And again, try and get your soft wrap through that web space best you can, trying to keep it as flat as possible. Okay, and then back to the wrist. Okay, and again, you may cut and tape. I guess one of the other strategies that's really important is thinking about completing your hand wrapping after your baby has had a feed, or after having pain relief that has been recommended in conjunction with your treating team. So those are some times, I guess, in the day, if they have had a feed and they have had their pain relief, that can make dressing a little bit more easy for them. Okay, so I'm just going to stop here. Around we go. You're going to finish your wrapping. Again, you're going to trim that at the wrist, tape that on. Okay, and there we go. So I've just shown you how to wrap just two of the fingers for a newborn, but just remember there are a number of strategies that you can use in isolation or in combination to make dressing a newborn's hand as easy for you as possible. What you can do is review the other sections of videos because you will want to complete the entire wrapping process with your newborn as well.